the women leaders in health are less than 30%.
Weiberbildung. Welcome back to Weiberbildung. This time we're speaking in English because I'm here with Phoebe. And Phoebe, you're doing a lot of work, really important work in Kenya. So that is also something that I really wanted to do for this podcast, to talk about healthcare in different countries, because probably healthcare, like the biggest questions are different ones than we are asking ourselves here, and it's always really important to like network and talk about the differences also, but also what we can learn from each other. And yeah, I'm super happy that you took the time. We're at the World Health Summit.
Yes, 2025.
Yes.
Yeah, the World Health Summit 2025.
Yes. So, and you're here in Berlin for the first time?
Here in Berlin for the first time in Germany, the first time in Europe.
In Europe?
So it's a first for me in so many ways. It's been a great summit, meeting a lot of world leaders and getting to share challenges across the borders. And just getting to learn on how developed countries are handling health versus the developing countries. So it's interesting. Yeah.
And can you introduce yourself just shortly for us?
Okay.
So what do you do?
Thank you very much. My name is Phoebe Ongadi. I'm the executive director for an organization called Kenyan Network of Cancer Organizations, also known as KENCO. So what KENCO does is that we are the umbrella body, the national umbrella body for civil society organizations in Kenya that deal with cancer coordination, cancer survivorship, cancer help, and cancer treatment across the country. So basically right now we are almost hitting 80 organizations that are spread across Kenya.
Wow,
yes,
80 organizations.
80, and we do coordination for patient support, coordination for palliative care, access to treatment, access to medication, and also awareness creation at the community level. So I would say what we do, we are the bridge between the policies that governments come up with and their implementation. So we are in between, always checking, ensuring that those policies actually benefit the people on the ground from the community level.
And you're an umbrella organization for 80.
Yes, almost 80.
Yeah, wow.
Yes, by the time I was leaving Kenya, we were at 76.
It's 76.
Yes, and we have membership requests every other day.
Wow, okay.
Yeah.
So it's like getting bigger and bigger. And KENCO, is there also something there for female health? Because I do like mostly female health, and I know that cancer for women is something completely different than cancer for men, as like the gender data gap suggests. So
So for us, when you talk about the cancer story for Kenya, it is a woman's story. Because right now, by the time we finish this interview, the next day, 24 hours, we'll have lost 8 women to cervical cancer. And cervical cancer is the number 1 leading cause of women cancer deaths in Kenya. And then breast cancer is the number 1 in terms of the numbers. So mostly breast cancer is being diagnosed but mostly they're dying from cervical cancer. If you look at those two only, it's only women who have a cervix. And then also if you look at the breast, it's only women who mainly get breast cancer. They say men only at about 2%.
Wow.
Our population is almost just slightly above half of it is women, 50.3%, and we are almost at 60 million. But when you come back and look at the burden of disease, it's on the woman, both on the non-communicable diseases burden, the hypertension, the mental health, the diabetes, the cardiovascular, it's on the woman. And then when you look at cancer, just as I've told you, the top 2 killer cancers are women cancers. So even without talking about your work, it is about the women are affected the most. And when you look at the non-communicable diseases in my country, every year, it is killing 41% of the population. And out of the 41%, it is the women who are mostly affected at 60% and above. So anytime we talk about cancer, when you talk about non-communicable diseases, you cannot go without mentioning woman. And the African mother always has to choose between food and medication. Most of the time, especially those who are below the poverty level, those who live in the rural areas, they always have to choose between giving my children food by medication. I don't know what you will choose. you will choose giving children food. For a man, he can, the little he has, he can go and buy medication and disappear, and it will be okay. But for the mother, she will hold back and say, no, no, no. I'd rather give my children food and my disease can hold up. When the disease is holding up, there's delay and all that. So the burden is on the woman. And thank you so much for what you do, highlighting the plight of women. I think everywhere women are just need the attention that they deserve.
Yes, yes. So what are like preventive actions that you do or that the network does?
Yeah, so right now, as the network, we have been doing a lot of prevention with the girls because we are saying, okay, let's go back now. Let's go back and try and save the girl. And we are lucky that our government rolled out something called the single dose vaccine. And I know in these countries and others, it targets boys and girls. But in my country, it is only funded for the girls. So if the boy would want it, they will pay. So we take advantage of that and try to get the girls earlier, between 9 and 14-year-old, and ensure that they get that vaccine. These are girls who are, in my country, it's about grade 5. So they are young, still in school. We are looking at how do we prevent them from eventually getting cervical cancer in future. And then we are also doing a lot of awareness to look at the women with no symptoms and encourage them to go for testing, encourage them to go for screening, and teaching them about the early warning signs, and then ensuring that they have the support that they need to go to hospital. And we are also telling the hospitals that when a woman comes, especially if they come from a long distance, just take care of her. So from my organization, we are doing a lot of advocacy, a lot of awareness, and a lot of empowerment for the woman and also for the girl child.
But that is also like, it's so interesting because like in Germany, the most women die of kind of like different diseases, more like cardiac failure and stuff like that, because it's like mostly we are a very old country, so a lot of elderly people, and that's why we have a lot of like illnesses that affect mostly like the elderly people.
Yes.
So that is already like super super different. And also you just talked about food or medicine. That is not something that we would ever think about to
they
choose
would think
between.
about selling land or medicine.
That is like, yeah, that is like so sad to hear, but also like something that we don't really get in touch with, because like I feel sometimes like we're so out of touch because we don't really have the opportunity to speak to other leaders of other countries. So I'm super happy that you are here and educating us about this.
Yes, yes, yes.
What did you think when you came to the to the summit today? What did you think about the German healthcare system, like in comparison to the Kenyan healthcare system?
Yeah, so I think the German healthcare system is amazing. Because it's like it's not shouldn't be like a headache to anyone. For us, just before I came here, we were in the streets of Nairobi and we were telling Parliament, no, you need to give money to health. You know, you are making noise all over as part of advocacy, because we are seeing that top 3 leading causes of death in my country are the preventable ones, the non-communicable diseases and the cancers, and yet they're getting the least amount of funding. So, and you know what also is happening on the global funding generally to African countries like ours. So it has to come back to domestic. So for us, it's a lot of headache. When we think of the 70% of the population that lives below the poverty line in the rural areas that will need help to be able to be fully covered. So you are pretty lucky. You should take advantage of that, and you should be grateful that at least the challenges that you have is the elderly and all that. Our elderly, it's not a challenge. The challenge is access to healthcare. It is getting the disease early. It is this woman getting support for her screening. It is this girl making sure that no one forces them for early marriage, no one forces them to do circumcision. It is ensuring that this woman has her rights around reproductive health, around screening and all that. So it's pretty different, but it's the difference that makes us unique.
Yeah, we had like I had this one research project where we talked about female genital mutilation and there not being diagnosis codes for it. So like the ICD, the International Classification of Diseases, doesn't have like worldwide code for it. So some nations implemented it, but some didn't. And I don't know, you just talked about like circumcision, so I would really like to talk about like this topic more.
Yeah, or for us in my country, they've even passed a law against it and they talk so much against it, but it still happens.
Mm.
And it still happens because of the culture, the traditions, and a lot of fear around it. And we do not have a clear way of diagnosing it. And the girls who eventually, some of those extreme communities that do not eventually take their girls to circumcision, the girls face a lot of stigma
Mm-hmm.
even among their peers. They're told you're not yet old enough, you're not yet grown up, you need to grow up, you need to get cut. And there are communities that do it the extreme bit of it, and some of these girls actually bleed to death.
Mm-hmm.
They bleed to death because, and then of course, most of the times it's not done in hygienic environments. It's one razor blade versus so many others. Some of them chop up the entire the labia major minora out.
Mm-hmm.
So it is devastating, but it's still happening. We are really trying, and one of the ways that really helped us was to involve the men. Now we have to go back and say, no, you see, when you you chop off a woman's part of genitalia, you're taking away her dignity. And then you're taking away even her pleasure in marriage someday. You're taking away her identity. You're making her grow up too quickly. And yet women are the backbone of society. If you train a woman, take a woman to school, you train the entire community. Yeah. So
Mm-hmm.
it is still a challenge. Though the law is protecting us right now, but even with the law, they still go behind the scenes and do it.
Mm-hmm. So you try to also integrate the men into this preventive work. And how does that work?
Yeah, for a long time, we have struggled with the four areas of preventive works. If you look at cancer, for example, the women, the cancers that are killing women, there is the breast cancer, cervical cancer, breast in terms of incidence, cervical in terms of mortality. And most of the times, we also now decided to teach the man, because you see the early signs of cervical cancer will be painful sex. So if such a happens, then if the man knows of those symptoms, he can come out. And then women who go for screening and early treatment, they're also told to stay away from sexual intercourse for some time. You cannot do that without the man. So it has not been easy. Issues around exclusive breastfeeding, we involve the man and tell them, okay, support the woman. If you come to the clinic with the woman, we will show you, we will treat you first. We will get past the line, so you get treated. So as they come bringing their wives to hospital, we take advantage of it and talk to them about also protecting the society, about protecting the girl child. But it is still not easy. So most of the times we empower the woman, but when they go back home, they meet the man who says, I am the boss here.
Mm,
Yeah, it's not
okay.
easy. Yeah.
Yeah. So
And then
that's why
also,
you have to include them.
we have to include, and the men, we are also pushing for women to be involved in the high policy leadership level. The women leaders in health are less than 30%. So that means most of the times when the men sit, they may not really consider the issues that affect the women. So we are pushing for at least half, 50% or even more of
Mm-hmm.
presentation, especially on women's health.
Okay. That is really good, but is that working?
Yeah, it's not, that's why advocacy, we
Yes.
always have to push and
Yes.
advocate, and
Yeah,
yeah.
yeah. Okay, that is also a problem in Germany, but I think we're on a good way to
Yeah.
get more women in leading positions.
Mhm.
But you're also like I don't know, like many people must look up to you, right?
Yes, many people, and that's why we have to speak out. Because if we do not speak out, especially on issues around health insurance, these women will go to hospital and they'll be told, come and pay. They will go back home and abandon treatment. And
Mm-hmm.
very soon they'll become a statistic. If we do not speak out to them, they will
Yes.
abandon treatment. If we do not speak out, there'll be so many children who will be left without a mother. If we don't speak out, there'll be so many families who will be left out without knowing what to do, because it is the woman who drives a society. So that's why we have to keep pushing,
Yes.
and we have to keep advocating. But it's also good to look at the positive side, that a lot of gains we are seeing gains out of those advocacy. Like, for example, we saw the improvement of the social health insurance fund. At least now we are sure Parliament is going to work on it, because just before I traveled here, we were on the streets and we took our petition to Parliament and they read it and they promised. So we hope so. And also the single dose vaccine for the girls,
Yeah.
that is now looking at the future. We hope that as many girls get it so that we eradicate cervical cancer.
Yes. Yes. And pretty early on, right?
Yeah.
So the earlier, right, the
Better.
better.
Mm-hmm.
Okay, that is that is such important work you're doing.
Thank you.
Really important.
Thank you.
I have one more question because I come from like digitalization, so that is actually what I was always doing, like trying to, when data is digitalized, make it kind of equitable. And now I'm asking myself, how digitalized are Kenyan hospitals?
I would say 40%. We still have those big books,
Mm-hmm.
the long registers you write. It's very long from here to here.
Yeah.
So we still have those. There have been efforts to digitalize it, and I think for the future we may just have to. But we are not totally digital yet. We still have those books, the analog books that we write and we write and we write.
Okay, but we also have a lot of paper-based documentation still.
Mm.
But that is like something also so important to get like data.
Yes, extremely important. And even for my work as an advocate, I need data to drive advocacy. Because if I sit here and tell you, I need, I'm pushing for this, you'll ask me, what are your numbers? Those numbers are data. So we also rely on really data for policy advocacy.
And with many cases, it's probably also like a high number that you cannot even statistically get, because a lot of women are, like, for example, not getting the healthcare they need, or not even getting to the hospital when they need it.
Exactly.
Like when you said like food or medicine, they would choose the food for the children.
Yes.
So that's data that will never be collected on real human beings who are,
Yes, and also on real human beings who actually abandon.
Yeah.
Because if you tell the government women are abandoning treatment, they will ask how many? How many of those? So yeah, so data is still important. So if they come to the clinic and they tell you I cannot afford, somebody should take that data and say, this today she came, she could not afford and went back home. So it is the treatment abandonment data.
And generally, how was the World Health Summit for you? Was it fruitful or?
Yeah, the World Health Summit has been extremely fruitful for me because just coming to learn on the global experts in health and coming to look at it, I like what they were saying in a fragmented world, and we want to do now from plans to action. We've been planning a lot, but now what is the action? And there's a lot of way forward. There's a lot of next steps. There's a lot of what next. There's a lot of why are we still here? We shouldn't be here with talking about these statistics. What should be done? So for me, the highlights, apart from the sessions that I was in the panel, just sitting down to listen to global health leadership and listen to where the world is going, where the global health is going. That was very refreshing for me. And that's what and the contacts, amazing contacts.
Oh, that's great.
So many of them, amazing contacts.
Oh,
people
so
coming
happy
to appreciate the work that we do. Sometimes when you're down there, you don't really see the impact. But when you come and actually come out to share, people appreciate, and that's really, it is very satisfying.
So I have one last question for you. Yes. And this is a question I always ask in this podcast. So you have to know beforehand. I think almost all of my interviewees are women. So I always ask, what is womanhood for you?
Womanhood for me is having to make a personal decision on my life matters, having to be able to decide about my health, having to be able to decide whether I want children or not, having to be able to decide whether I want to get married or not, having to be able to decide my level of education without many other factors putting me down, having to decide how I dress and how I show up. That is womanhood for me. Having to choose good versus nice, because women, most of the times we are taught to be nice, smile, be happy, normalize pain. But what is the purpose? I believe in standing up for a purpose, because we are done with the generation of being nice. Nice, we are living it now. Now we are going to purposeful living. If you want to do this podcast, you should be able to do it because your heart wants to, not because of any other pressure. That for me is womanhood.
Oh, thank you so much. That is such a great answer.
Thank you.
Thank you. That was such a good interview.
Thank you so much. I'm so happy I'm happy that you came. Thank you for hearing our story, and yes, let it go out there.
Yes.
Let also the world know the kind of work that you're doing.
Yeah.
And when you start looking global, now the sky is just the limit.
Oh, thank you.
Yes, one day you should come to Kenya.
I will.
So we go and look at those girls who are circumcising, and you talk to them and get to hear why they do it.
Yes.
You can.
Okay.
Why not?
Okay.
Thank you.
Thank you.
You're welcome. Okay.
Weiberbildung.